Welcome everybody and good evening. Today we're going to be talking about management and reversal of stroke. I remain my humble self Lucky, aka Dr. Drugs, and I have the pleasure of presenting this topic. And once again, I say welcome and thank you for being here to listen. And I hope that we learn a lot tonight, as we're going to talk about things that are not really often discussed with regards to management of this debilitating lifestyle disease condition called cerebrovascular accident. So, yes, this is the flyer that most of us got, stroke management and reversal. Here is our table of content. This is what we're going to talk about today. Of course, we can't talk about stroke without talking about lifestyle diseases briefly, and then we'll delve into stroke itself, its types. Then we'll talk about stroke as a complication of lifestyle diseases. Talk about its relationship with obesity, diabetes, hypertension, high blood cholesterol, and stroke. Then statistical occurrence of stroke, signs and symptoms of stroke. Then we'll talk about the causes and risk factors, complications, prevention, management, and reversal. That is very key. Then we'll have to talk about chemical intervention and also talk about the importance of natural pharmaceuticals in stroke prevention, management, and reversal. I always like to emphasize that the two greatest assassins on earth are cholesterol and stress. And let's bear in mind that in case you hear me mention the word called ischemia, that simply means cell death as a result of hindrance of blood flow through the arteries of affected cells, leading to lack of oxygen and food to the affected cells. That means this lack of oxygen and food lead to their death. That is what that means. And cholesterol deposits, of course, we know directly affects or causes what is called ischemic stroke. If you remember what I said is the definition of ischemia, you can see the relationship between ischemic stroke as well as ischemia and cholesterol deposits as well. Stress, as we know, destroys DNA. That is why cholesterol and stress remain the greatest assassins, even higher than terrorists and the ones that act movies, people that act, the ones in the movies like 007 and Mission Impossible. You understand? This is more deadly than them. Now, what are lifestyle diseases? Briefly, lifestyle diseases are linked to one's lifestyle. They are non-communicable and usually have a long duration. Examples of such lifestyle include lack of physical activity, poor dieting, alcoholism, smoking, substance abuse, lack of rest, and other lifestyle choices that affect our health badly. So these are just a few examples of lifestyle diseases, but today we're going to focus on stroke, but the others are listed below, like cardiovascular diseases, like heart disease, like hypertension, atherosclerosis, obesity, type 2 diabetes. And now, the prevention and management of lifestyle diseases entail avoiding the avoidable risk factors, and lifestyle diseases are mostly reversible, but the earlier, the better. Very briefly, we're going to talk about cardiovascular or heart diseases, and of course, they include coronary artery disease or heart disease or cardiac disease. Then hypertension, stroke, angina pectoris, rheumatic heart disease. A lot of people don't know that rheumatism can actually cause issues in the heart. Cardiomyopathies, especially my favorite, which I always like talking about, which is Takotsubo syndrome, which is heartbreak syndrome, which is a result of deep emotional stress. We have cardiac arrhythmias, abnormal heartbeats. We have poor heart function, inflamed heart muscles, as well as peripheral artery disease. More. Stroke, cerebrovascular accident, simply defined as brain cell death due to poor blood flow. Any part of the brain that dies leads to a loss of function on the corresponding part of the body. There's something called contralateral paralysis. What that means is that if the left side of the brain is affected, the right side of the body is affected. If the right side of the brain is affected, the left side of the body is affected. That's why sometimes when people say that they have a left-sided stroke, it means that the right part of the brain is where the incident or the cerebrovascular accident occurred. But bear in mind that it's also called a brain attack. Just as we have heart attack, it's also called brain attack. And the way they happen are quite similar, related. So the types are, briefly we'll talk about the types. We have hemorrhagic or bleeding stroke, which happens about 10 to 13% of cases. And it's as a result of weakened blood vessels bleeding into the brain, and this may happen after the blood vessels balloon. we can all guess what can cause this because of an increase in pressure or a damage or anything that affects the integrity of the blood vessels in that area. That blood vessel begins to what? Balloon and can rupture. So let's just bear in mind that as opposed to the ischemic stroke, we have to avoid the use of anticoagulants and antithrombotics, that drugs that hinder cholesterol blockade, as these may worsen hemorrhagic stroke. Because in ischemic stroke, we'll see why this statement is very important, and we have to understand why it's very, very critical and very, very important that we identify the type of stroke first before administering any form of treatment. So, ischemic stroke, or quote blockage stroke, this happens about 90% of cases. It's often as a result of cholesterol deposit blockage. So we're going to concentrate more on this because this is the one that affects more people. Although this evening I had a patient that had hemorrhagic stroke, which is, in fact, that's after about maybe 100 patients that have had ischemic stroke. One had hemorrhagic stroke so far. So you can see that it's often as a result of cholesterol deposit blockage or atherosclerotic plaque. Let's take note of this word, which interrupts blood supply. But guess what? People have this condition sometimes without even knowing, because it resolves after 24 hours, and that's what we call a transient ischemic attack. Now, if an ischemic stroke resolves itself within 24 hours with full recovery, it is known as a transient ischemic attack. Please, let's take note of this, because we're going to talk about a bit about it later. So now, but in both types of stroke, something is common between them, and that is brain cell death results leading to an area of dead or dying cells in the brain, and accumulation of free radicals which damage DNA and cause inflammation, leading to more complications. Remember that it is brain cell death due to poor blood flow. So either the blood is blocked or the blood vessel has ruptured and it is basically bleeding into the head rather than supplying the cells of the brain. And these are the things that lead to the complications associated with stroke. So, stroke as a complication of lifestyle diseases. You see, we just talked about lifestyle diseases briefly, and we can see that lifestyle diseases are interrelated and are often risk factors for each other. They work together. They move like a gang sometimes. So stroke is a lifestyle disease, hence has other lifestyle diseases as risk factors, or in quotes, Ashebi or bridal train, as I said, when I was talking about intellectual disabilities. And you can see that this include, of course, these risk factors include a previous stroke or transient ischemic attack. Remember, we just talked about transient ischemic attack. Obesity, because I always ask patients, what is your weight and your height? And some are wondering, what do you need my weight and my height for? Do you want to marry me? But because we need to calculate the body mass index to know if one is severely obese or not. Then diabetes type 2 is a strong risk factor. High blood pressure, fatty liver disease, and so on and so forth. But just on the side, let's just note that sickle cell disease is actually also a risk factor, because when the cells hook and clog up the blood vessels as a result of their shape, and just hook each other that way, and could prevent blood flow to certain parts of the brain and lead to a stroke. That's just on the side. Topic for another discussion on that topic for another day, or a discussion for another day. Now, obesity and stroke. Obesity is associated with an increase in risk of stroke, as it can lead to conditions like high blood pressure, high cholesterol, and diabetes, which are all risk factors for stroke too. So you see why I say they are interrelated and work hand in hand. These lifestyle diseases are terrible. They support each other so much. Now, furthermore, excess body fat can cause inflammation and damage to blood vessels, increasing the likelihood of blockages and stroke. Let's take note of this word inflammation. We're going to come across it over and over again. So maintaining a healthy weight through a balanced diet and regular exercise is crucial for reducing the risk of stroke and overall cardiovascular. So more specifically, this is how obesity can cause stroke: via high blood pressure, high blood cholesterol, as I've explained, diabetes, especially type 2 diabetes, inflammation, as I've explained, blood vessel damage, because an excess body fat can cause damage to blood vessels, making them susceptible to blockages and stroke. Heart disease, Sleep apnea, of course, obesity can lead to the risk of sleep apnea, which increases blood pressure and increases the risk of stroke. Atherosclerosis, obesity can accelerate the buildup of plaque in blood vessels, leading to atherosclerosis and increase the risk of stroke, and increased risk of hemorrhagic stroke. Of course, we know that obesity can increase the risk of hemorrhagic stroke by causing blood vessels to become weak and susceptible to rupture. Of course, it can also lead to a reduced blood flow. Of course, remember we're talking about brain cell death due to poor blood flow. So we have a video, a seminar already on YouTube with regards to this. You can go and look it up. And I think titled Lifestyle Diseases and Weight Management. You learn everything you want to know about how to manage obesity. Now, diabetes and stroke. Why is that a lot of people that have diabetes also have stroke? We're going to find out shortly. So diabetes can cause stroke because it causes a much higher risk of having stroke. This is because diabetes can cause a buildup of sugar in the blood, which can damage blood vessels and increase the risk of blockage, which can cause a stroke. It can also lead to a terrible increase in bad cholesterol levels. We're talking about very low density lipoproteins and low density lipoproteins, which in turn leads to blockage of blood vessels and stroke. It also leads to detrimental buildup of free radicals or reactive oxidative species that lead to damage of DNA of the blood vessels cells. So you can see that diabetes is truly a disease of diseases. So more specifically, this is how diabetes causes stroke. It's good we understand these things so we'll know the things to avoid or know the importance of the things we do to try to help reverse stroke. So damage to blood vessels, of course, atherosclerosis, which is it can accelerate the buildup of cholesterol blockage or plaque in the blood vessels. So you can see we talked about that recently. Blood clots as well. Diabetes can also lead to high blood pressure, as we all know. And then cardiac diseases as well, because diabetes can increase the risk of cardiac disease, which can lead to a cardiac embolism or traveling cholesterol blockage. That means a piece of the cholesterol blockage can break off and enter the bloodstream, travel all the way to the brain and block something there. That's why that's also very, very dangerous. Now, diabetes also damages the kidneys, and the kidneys play a very, very amazing role with regards to regulation of blood pressure. We talked about that in the video when we were talking about reversal of hypertension. Then diabetic retinopathy. Once the eyes are having issues as a result of diabetes, it's a marker to show that it's possible that the blood vessels in the eyes that are having issues are also having their colleagues in the brain about to have issues, already having issues. Of course, inflammation is here again. Platelet aggregation as well. Diabetes can increase the risk of platelet aggregation, of course. Then we have what is called vascular dementia. That means vascular dementia just means that the ability for one to remember or do things that they normally do with their brain becomes diminished as a result of the negative effect of diabetes, especially on the blood vessels in the brain. And we can also go to YouTube and watch a seminar on how to manage and reverse type 2 diabetes. It's also there. So now, high blood cholesterol can cause plaque buildup in the blood vessels. You can see what plaque is. Look at it over here. You can see this is a blood vessel. Even if you look closely, you find out that some of the red blood cells are already turning blue because they have been here for so long, no movement. And of course, a clot is already forming there and completely block that area. And you can see just a few of them are trickling through. But for how long? See, before you know what's happening, the cholesterol and its colleagues will help to completely block the blood vessel, starve some cells in the brain of oxygen and food. The person will have what is called an ischemic stroke. Now, high blood cholesterol can cause plaque buildup in the blood vessels, which can lead to blockages and reduce blood flow to the brain, as aforementioned, increasing the risk of a stroke. Additionally, high blood cholesterol can increase the risk of heart-related diseases, for example, hypertension, which is also a major risk factor for stroke. If you watch the video or the seminar, you can go to on YouTube and get the seminar on management and reversal of hypertension, and you see where it was explained how increase in peripheral resistance makes the heart to have a compensatory increase in blood pressure. But guess what actually mostly leads to an increase in peripheral resistance? Cholesterol blockage. That's how it's related. So, but more specifically, it does this through atherosclerosis, blood vessel narrowing, blood clots, heart attack, and cardiac embolism. Because heart attack as well, as we know, is as a result of cholesterol blockage in the heart. The way it blocks in the brain can also block the blood vessels of the heart, where the arteries of the heart, and of course, the traveling cholesterol blockage or an embolism can travel to the brain, as I've described. Peripheral artery disease, as I've described. Deep vein thrombosis, which also increases the risk of stroke, and is also often secondary to high blood cholesterol. Then we have carotid artery disease. That's the artery somewhere here that supplies the brain. Fortunately, sometimes cholesterol can block this artery here and cause a lot of problems, because there'll be shortage of supply to the brain, or part of it can break off and cause complications in the brain. Then we have vertebral artery disease. Bear in mind that your spinal column that protects the spinal nerve, that's the nerve that goes from the brain all the way down to our back and supplies different parts of our bodies. So you see that that part of that particular network of nerves that goes all the way down and supplies different parts of the body, it's very, very important to have adequate blood supply. But unfortunately, sometimes cholesterol also goes there and blocks that supply, as you can see. So, and in that way, can actually cause a lot of issues. And then we have increased inflammation, once again, disrupted blood flow, and increased risk of hemorrhagic stroke. So hypertension and stroke. Now, the high blood pressure hypertension is a leading risk factor for stroke, because it contributes to about half of all cases. So hypertension can cause stroke in multiple ways, including by damaging blood vessels and causing blood clots in the brain, damaging the tiny blood vessels inside the brain, and causing bleeding in the brain. As blood pressure rises, blood vessels may rupture. That's in the case, as I mentioned, the bleeding stroke or hemorrhagic stroke, or get blocked. As I mentioned, we talked about ischemic stroke or cholesterol blockage stroke, as a result of cholesterol attaching to the damaged blood vessels, as a result of high pressure against the walls of the blood vessels as well. Now, this eventually leads to what? Starving of the brain cells. They supply nutrients and oxygen, killing them in the process. And that is how hypertension causes stroke. But more specifically, it causes this through atherosclerosis, as I've described, blood vessel weakness, blood clots, aneurysm formation, as that thing that's like that when the blood vessel begins to swell up and form something like a ball that becomes weak and can just rupture and lead to a bleeding stroke. Then atherosclerosis. Atherosclerosis is simply narrowing and hardening of small blood vessels in the brain, reducing blood flow. Then we have cerebral edema, because high blood pressure can cause fluid to seep out from the blood vessels into the brain and cause a fluid buildup, leading to swelling and increased pressure, because we know where that can lead to. Then we have cardiac embolism, as I mentioned before, amongst others. But if you want to know a bit more on how to manage or reverse hypertension, you can go to the YouTube, go to my YouTube channel or page, then you see a very, very clear seminar on that. Now, what are the signs and symptoms of stroke? Let's bear this acronym in mind. FAST means fast, because it means face drooping. As you can see, this man here, one side of his face seems to be dull, while the other side seems to be alert. That's one of the symptoms of a stroke. Arm weakness. He can't raise both arms to the same height because of the weakness involved. You can see that obviously this person is having a left-sided stroke, because he can't raise his right hand properly. You can see his left hand is well lifted. Then we have speech difficulty. If you look at his mouth, you can see one side of the mouth seems as if he's smiling, the other side is not even smiling at all because of these issues. Then it's also time to call emergency services. Also, there's confusion, paralysis on one side, loss of balance, loss of vision, dizziness, and sudden severe headache, as if Shango, Amadioha, or Thor or something that just struck the person's head. That is a very terrible sign of a possible stroke. So one has to take note of these. So just briefly, these are just a recap of the causes and risk factors of stroke. A previous stroke is a risk factor. Hypertension, as I've mentioned, high blood cholesterol, brain embolism, cigarette smoking, obesity, diabetes mellitus, especially type 2 diabetes, increases the risk of stroke by 200 to 300%. alcoholism increases bad cholesterol level, lack of exercise, drug use and abuse, because that period when some people, patients are getting high and they're having this fast heart rate, that BP shoots up and can rupture a blood vessel in their brain, and they can have a stroke, which one may say that it was as a result of an overdose or something, but sometimes you find out that it was actually a stroke that kills such a patient. Then, of course, poor diet, because some people say they don't like vegetables, they want to sleep in Mr. Biggs, Chicken Republic, or Tasty Fried Chicken without exercising and all that. And you can see that lack of veggies and processed red meat consumption can also predispose one to having a stroke. So what are the complications of stroke? Seizures, because of course we know that once there's a problem in the brain, you can see that the brain cells or nerve cells in the brain can begin to misfire. Paralysis, terrible bed sores. Please take note of terrible bed sores, because sometimes people lie down as a result of their paralysis when they are paralyzed. But when one stays on a position for too long, these pressure sores come up and can be quite deadly, because they can lead to what is called sepsis, or infection of the blood. And it's quite terrible, because at the end of the day, a huge chunk of the person's flesh may have rotted off and has to be debrined or removed. And you see, we hear some people, someone that's having a stroke, now start talking about plastic surgery and all that. So it's very important that the patient is turned regularly. And also, I'm going to talk about certain things that can be used to assist. This is one of the cases where oftentimes chemical drugs cannot really do much as physical activities like turning the patient regularly and all that in preventing it. Now, pain and numbness in affected area, we know the brain controls different parts of the body. And of course, the spinal cord goes down the vertebral column, and can actually moves and supplies nerves to different parts of the body as it goes down and spine down the back. Cause vision and hearing problems, muscle weakness, memory loss and trouble thinking, depression and suicidal tendency. Imagine someone that was so active that people used to be afraid of and people used to respect. All of a sudden, the person is now babbling, and the person cannot even sign a check. And you see people that he never believed he would have to hand important things over to. Handling things for him, it's a terrible situation. Imagine somebody that used to be a soldier or a general now being carried on a wheelchair and using Pampers or something. It's so terrible. So it can lead to depression and suicidal tendency. So let's take note of that. Then, of course, a predisposition to another stroke. I know someone that has had stroke 3 times. In fact, the 3rd time, I was the person that told them that this may be a stroke. Rushed to the hospital, and when they got there, they discovered that that was actually a stroke. Then, of course, economic challenges. If you have an idea of how much people spend with regards to taking care of a stroke that has already happened, or taking care of the comorbidities that are associated with stroke, trust me, you will not believe that. If someone spends less than 20 million, that person is lucky, honestly speaking, because anything can happen. Person may have to rush to the hospital. Emergency, these days it's very expensive in so many places. So the economic challenges can begin to come up because the person is not even really working so hard as before. So where is the money going to be coming from? And now the person has to spend money compulsorily taking care of the stroke. So the patient is actually, at a high risk of having economic challenges. And of course, the disease of all diseases, the real disease of all diseases, which is death, which is a disease that people do not come back from. So this is statistical occurrence of stroke in Nigeria. Stroke is the most frequent cause of death after coronary heart disease. Now, it has an incidence of 114 people per 100,000 and kills about 40% of these people in 30 days. Can you imagine? So management of the disease is largely conservative with little or no funding for research. So if you find very little research work going on about stroke, that's why people are left in confusion. Just don't know what's going on. They don't know what to do. Some are just trying all sorts of things. Anytime they just see somebody on Facebook or someone on social media selling one thing in a bottle, they say you wear one ring or drink one thing and you to disappear. They just keep buying and drinking because a lot of confusion. There is no much research going on in regards to this in this part of it. I hope things change in the future. So let's talk about prevention, management, and reversal. Of course, one has to monitor blood pressure. It's very, very, in fact, I have one, I always move around with this. It's very portable. Just get something simple like this. This is a BP machine. You understand? And of course, it's actually a sphygmomanometer. You can see Very simple and portable. You can even put it in your bag. So if one is not even sure of anything, just bring it out and measure your blood pressure. It's very important. And it's also good that people avoid diabetes. In fact, there's one, I think I have it in my drawer here. There's one like that I have here. I wish I had. Okay, maybe it's not here. And I've shown very simple, a very tiny purse like that. In fact, you will not even know it's in your bag. Sometimes one is just check your blood pressure and fasting blood sugar level at least regularly. And this is one of the surest, especially when people have had parents or loved ones or that are related to them that have had these lifestyle diseases before. It's very important. Weight management is also very important. There's a video on YouTube where I spoke about lifestyle, making good lifestyle choices, as well as weight management. It's a very wonderful video for you to go and watch and see how to professionally manage weight. I'm not talking about malnutrition, which can even cause a lot of damage because the cells become starved and shriveled. We're talking about how to remove just the fat and keep the cells nourished. Of course, good lifestyle choices are also very important. Quit smoking, avoid alcoholism, rest, and all that. Especially this period where, the economy is somehow hoping for the best. You see a lot of people are working harder and rest less because you need to work more these days to get what was easily gotten before. So one has to be careful to make out time to rest. I'm even talking to myself as I'm talking to us because I also fall victim of this. Sometimes I find myself working for a long time and I just have to just pause and sleep for 1 hour or two just to help myself not to have issues. Physiotherapy is very important. And in fact, I was fortunate enough to make friends with a neurophysiotherapist, and he has an amazing, in fact, he's actually in our health team. I think Dr. Newton, yes. Very wonderful neurophysiotherapist that has taken care of patients that I know of. And in fact, he's amazing. That shows you that physiotherapy is also very important, but when one is in the right hands. Of course, we have to eat healthy, high fiber and veggies. I'll give us an idea of what a Mediterranean diet is shortly. I love that picture so much, and especially the fact that it's named after a group of people. That means it's something that they have been doing for thousands of years, and the result is very clear. One has to exercise regularly because it reduces the risk of having a stroke by 26%, which is amazing. Now, chemical drug intervention, we'll talk about that shortly, is good, but we also have to be careful and cautious. Then you see the use of conventional medication in management of stroke. We mentioned a few. So then, of course, natural pharmaceuticals in stroke prevention and management and reversal. That will also be what we're talking about shortly. Now, chemical drug intervention is good in the sense that it can help to take a patient out of danger. For instance, we have the antithrombotics that prevent blood clots from forming and growing. Then we have the thrombolytics that dissolve blood clot. We have the antihypertensives that help to control high blood pressures, the statins, that's the ones that have to help us to control blood cholesterol levels. Then we have the anticoagulants like heparin and apixaban. We prevent blood clots from forming, antiplatelet agents. We have the neuroprotectants. We have the pain management medication. But let's bear in mind something. You see, these things help to take patients out of danger. But this medication can save lives, but upon chronic use may manifest adverse side effects. If you go and ask patients that have stroke, you find out that a lot of things that they take at the end of the day, they begin to have these side effects. That's why it's very important that one should endeavor to shift more towards making good lifestyle choices and not changes and use of natural pharmaceuticals. These are safer and help to solve the problem. In fact, they can help to prevent the problem in the first place. Because of the way they operate naturally, you understand? And these chemical drugs, when they are withdrawn, you see that the problem comes back because the problem has not been solved in the first place. So they are actually designed to take patients out of danger. And bear in mind that I keep asking this question, these chemical drugs, where are they going to? So one has to take these chemical drugs, but also bear in mind that good lifestyle choices will also help. Nobody's going to advertise a chemical drug and advertise the side effect as well. That's just the truth. Nobody will do that. But if you go and check for the side effects of these chemical drugs, then you realize why it's important. We pay very close attention to having good lifestyle choices and also use of natural pharmaceuticals, at least to the point where the health practitioner will say, okay, you can now reduce this or remove that. and you can, or when one has a clean bill of health. I have a patient that went back to his GP, and just his friend and GP checked him and was like, "What did you do? How come you don't have hypertension, no diabetes? What's going on? I've been managing you for long." And this doctor actually called me, and today the doctor is actually in our health team right now, because I explained to him from a molecular level how the things I did helped this man to reverse all these lifestyle diseases, including type 2 diabetes and hypertension and all that. Until today, the man doesn't have them. You see? But when he was taking the chemical drugs, of course, he was fine. But anything that made him not to take those chemical drugs, the problem comes back almost immediately. That's the big difference between what I'm talking about and what people do. So I'm not saying that you should adjust your medication without the consent of your health practitioner, but you should also try to consider these options. So these are the other types of ways that stroke can be managed. And we have the tissue plasminogen activators. We have a lot of them, non-invasive brain stimulation, and some of them that a lot of us have not even heard of. But the most important thing here is to act fast. That's the most important thing. Oh, all things bright and beautiful. Just look at how beautiful this table is. This is how people that live healthy eat. You can see that there's no Semonis, no Azul, no Hennessy, no Benson, no Remy Martin, no whiskey, no spirits, just lovely, natural, colorful foods full of antioxidants. And this is an example of what Mediterranean diet is. So what are the importance of natural pharmaceuticals in stroke prevention, management, and reversal? Now, they help prevent atherosclerosis, which is the origin of ischemic stroke in the first place. That's cholesterol plaque formation blockage, and promote healthy blood vessels. You know that these things happen within those blood vessels. So those blood vessels have to be healthy. They have to be in top form, because the brain has the brain is just like an airplane. There's nothing like park the airplane in the air, let's come down and push it. If there's a problem, it's usually often very serious. So they have to prevent and manage lifestyle diseases that cause stroke. As aforementioned, we mentioned all those lifestyle diseases like type 2 diabetes, obesity. They neutralize harmful free radicals that accumulate around the area of the brain cell death after stroke. It's just like having a dead piece of meat lodged inside the brain. So you can imagine how irritating it can be. And you can see that a lot of inflammation can begin to happen around there, worsen or complicate the stroke even. Then we have they help to rejuvenate and stimulate rapid healing of damaged blood vessels and brain cells. They help to regain neuromuscular function, okay, in case of paralysis. Understand? And they help to prevent recurrence of stroke, because a stroke itself is a risk factor for stroke. You can imagine. So you can see. And they help in reversing memory loss. We'll talk about that shortly. And they help to mitigate inflammation and pain and fight depression. Very, very important. So now, I'm not saying that these are the things I'm saying that we should use, but these are examples of what I use for my patients, and they work 100% well for them. And I have a very amazing success rate in regards to management and reversal of stroke, especially ischemic stroke. Eicosapentaenoic acid and docosahexaenoic acid, EPA and DHA, are called essential fatty acids. And they really help because they have very powerful anti-inflammatory effects, and are also called brain food because they are essential, because the body cannot do without them but cannot produce them. So you see that this EPA and DHA is very important for proper brain function and rejuvenation, helping to reverse memory loss after stroke, because it depends on the part of the brain that the stroke occurred. Because if it occurs in the part of the brain, maybe around the hippocampus or somewhere that has something to do with processing of memory and all that, you can see that maybe movement of memory from short-term memory to long-term memory, there can be a problem in regards to memory after a stroke. And you can see that it's a very powerful anti-inflammatory agent as well against inflammation in the brain as a result of stroke. But more specifically, it helps to reduce inflammation and oxidative stress, which contributes to stroke damage. You know, oxidative stress as a result of reactive oxidative species also lead to DNA damage and cause problems everywhere in that area. Then they help to improve blood flow and blood vessel flexibility, reducing the risk of blockages, more blockages in future. They support brain function and neuroplasticity, that's the ability of the brain to be malleable and adaptable, and to learn and improve itself, aiding in recovery. It helps to regulate blood pressure and cardiovascular function. Of course, if you go to the video where we talked about reversal of hypertension, you see this EP and DHA, spoken about in detail there. So the regulation of blood pressure and cardiovascular function helps reverse hypertension, which is a major risk factor for stroke. This is under one of them. This is garlic thyme, contains lecithin that helps to dissolve or emulsify fats. Remember that you can also always go and research these things, see for yourself that these things are actually very effective. So hence prevents and reverses formation of atherosclerotic plaques that cause stroke and helps against hypertension by reducing peripheral resistance. It also has powerful antioxidants that attack harmful free radicals that form around affected brain cells in stroke. More specifically, it helps reduce high blood pressure and cholesterol levels, which lead to increased stroke risk. Prevent blood clots and platelet aggregation, reducing risk of blockages, improve blood flow, reduce oxidative stress, and support immune function. This product has been used for thousands of years, and its uses are indeed numerously numerous. But let's just go straight to the most important part, which is that it's an adaptogen, which means it adapts the situation back to what it's supposed to be. That means when you take this product, the way you wear, or in what we call folocom in Nigeria, or the way you are supposed to be, is how this product begins to take you back to whatever it is it tries to repair, because it stimulates somatic stem cell healing. That's the real deal. We're not talking about, yes, stem cell technology is on the line, but many of the things that are called stem cell these days are all fake. The stem cells that are available for us, mostly apart from the ones in the bone marrow, that are the pluripotent stem cells that differentiate into different blood components, just to mention a few. The others are called somatic stem cells, and only somatic stem cell stimulants can activate them to initiate repair of damaged cells and tissue in the body. So once you hear somebody saying, I'm sending stem cells under your tongue, put in your mouth, of course, the layer under your tongue has living cells that form it. So I'm saying that cells are going to pass through cells. No. So that's not true. You also have people talking about swallowing stem cells. Of course, the hydrochloric acid in the stomach will destroy any cell that is there in the first place, most likely. So that is also not true. So somatic stem cell stimulation is the real deal. And aloe vera gel has been doing this for thousands of years. So aloe vera gel specifically has anti-inflammatory properties, reduce swelling and inflammation in the brain, antioxidant properties, protect cell damage and oxidative stress, improves blood flow and vessel flexibility, increasing oxygenation and nutrient delivery to the brain, which was the problem in the first place when there was blockage. So you can see that it helps to counter this issue. That's why when I give my patients that have stroke this thing, they begin to sing songs of joy, because they begin to feel their brain becomes relaxed, first of all, because there's better blood flow. Of course, adaptogenicity has been spoken of. Immune function is also not left out. It has antioxidant properties and supports blood vessel health and integrity, supports brain function and neuroplasticity, and as well as, but bear in mind, it contains atraquinones, acemanan, glucomannan, it is that help against pain, immune, and do help to boost immunity, and of course, blood vessel health. This product is in fact, this is one of the best products I have encountered because of the coenzyme Q10 that is embedded within it. So you see, coenzyme Q10 is an essential biochemical molecule for proper function and rejuvenation of the heart, liver, lungs, and kidneys. Hence, helps in management of hypertension. Remember, we said that 50% of stroke cases as a result of what? Hypertension. At least, but even maybe more as a result of hypertension. So it's a major risk factor for stroke. But more specifically, the ingredients in coenzyme Q10 in cardio health helps to mitigate or helps in stroke management and reversal via its antioxidant properties, because it protects against cell damage and oxidative stress, supports energy production and cellular level. You know that people that have stroke often are weak. You understand? Because the brain is not supplying the nerves impulses that go down the spinal cord all over the body, and that's why they feel weak, especially on one side. And this will help to provide more energy for them. Now, we talked about improving blood flow and vessel flexibility is super important, because you know that was what the most people that have ischemic stroke are suffering from oftentimes, because the blood flow was hindered as a result of cholesterol blockage. So this, you can see that will help. Of course, it also supports heart health, heart rhythm, and cardiovascular function. helps reduce blood pressure and cholesterol levels. Then it supports blood vessel health, integrity, and healthy blood circulation, as aforementioned, boosts immune function and overall health, supports brain function and neuroplasticity. Amazing. Then it also helps to reduce inflammation, contributing to stroke damage. And of course, it reduces the risk of what? A future stroke. Because one of the risk factors of stroke is a previous stroke. Please, let's take note of this product. This is one of the products that are inevitably important with regards to stroke. This is because it contains L-arginine. L-arginine itself is an amino acid, and I'll tell us why it's very important. Now, L-arginine leads to production of what? Nitric oxide, which is very, very essential because it's a natural vasodilator that allows for better blood flow, hence hindering cardiovascular problems and hypertension, preventing and mitigating the incidence of stroke. But as a bonus, it boosts muscle growth because it's an amino acid, and our muscles are made of amino acids. So what does it do? It begins to help to build these muscles up and mitigate that weakness that's associated with paralysis. So when someone is having physiotherapy, one should be taking this product very, very religiously to prevent muscle tissue atrophy because of the debilitating situation due to paralysis as a result of stroke. Now you can see that as a bonus, it also helps men because oftentimes people that have stroke often have it as a result of hypertension. But of course, we know that certain medication for hypertension also kill or hinder the performance of the entanglement facility. You can see that because this thing improves blood flow as a result of the nitric oxide, of course, it improves blood flow in the upstream sector and also in the downstream sector, making the man and the owner of the entanglement facility very happy. Now, more specifically, the ingredients in Agi Plus help against stroke via improved blood flow and vessel flexibility via increased nitric oxide production, relaxing blood vessels and improving circulation. It supports immune function, help reduce blood pressure and risk of future stroke. It has antioxidant properties, which is against, of course, cell damage and oxidative stress, support blood vessel health and integrity, and supports homocysteine metabolism, reducing the risk of blood clot and vessel damage. Is this not amazing? Now, remember we talked about depression. So you can see that this blossom tea contains chamomile that helps to calm the body down. Of course, there's something else called royal jelly that would have been here, but maybe subsequently I'm going to show us what royal jelly is. In fact, royal jelly is so important because it contains what is called choline. But I'm going to show us something that is also very, very important, and maybe not particularly royal jelly, but something that is awesomely important, that contains something that is related to what is in that royal jelly. And that royal jelly is very important because it contains natural choline, which is because of what? Acetylcholine, that is a powerful neurotransmitter in the brain. But we're going to show us something that is related to that shortly. Now, because of the bed sores associated with stroke due to the paralysis or pressure sores, we have things that can help to heal these wounds so that it don't get worse before people start talking about plastic surgery or someone that is already having stroke. So you can see that these contain substances like the propolis tab and propolis cream contain propolis, which is very powerful antimicrobial agents embedded in an adaptogenic gel or aloe vera gel, which helps to stimulate somatic stem cells to cover up the area where the bed sore has led to the debridement or removal of dead tissue. You understand? I've witnessed someone that's had a terrible bed sore that the sacral vertebra or the bone at the lower back was just open like this. You could tap it with a hammer because they had to remove the dead flesh. And while they were discussing on what to do, where to take the patient to for plastic surgery, and I suggested to the patient to use this product, and believe it or not, while they were still making arrangements, the flesh began to cover the bone. And as I'm talking to you, after about 6 months, everything covered and the flesh grew out and skin began to form. In fact, it's a miracle, not even like a miracle. There was no need for plastic surgery anymore because these things stimulate somatic stem cell healing and also prevent infection. So you can see that it's very important. Now, this is the product that I was talking about because it contains a noble molecule called cognizin. Cognizin is a premium nootropic or smart drug. These are drugs that help to improve focus, attention, and memory. And Forever Focus contains a patented form of citicoline, which is, of course, a smart drug to the brain to support what I just mentioned, focus, attention, and memory. These are just a few of the extra ingredients in this Forever Focus. This product is amazing. In fact, as I'm talking to you, I have a patient that orders this product from UK, and the testimony he's giving is just amazing. This citicoline is an analog of acetylcholine that is a powerful neurotransmitter in the brain. So you can see that neurotransmitters actually are necessary for the brain cells to communicate with each other and to store, process information, and also supply information to our bodies to move and all that. And that's why this is super, super, super important, as well as the choline found in royal jelly. So you can see that the ingredients in Forever Focus can help to resolve stroke via enhancing memory and cognitive function, support brain health and neuroplasticity, improve blood flow to the brain. Can you imagine that? In fact, it's so awesome. And it contains antioxidant properties that help to protect against cell damage, reduce stress and anxiety, improve mood, improve mental performance and focus. We talked about that in regards to citicoline, and of course, improve nerve function and transmission. In fact, this product is truly an amazing natural pharmaceutical in short, because there are so many things it can do. But let's just stop here for now. So another wonderful product is Forever B12 Plus, which contains cobalamin analogs, folate analog, pyridoxine, etc., which are essential for nerve repair and health. Remember that the brain itself is virtually, in a very crude definition, a ball of nerves floating in fat. That means nerves health are very, very essential when it comes to repairing damaged brain tissue that are usually secondary to stroke as a result of starving these cells of the necessary nutrients they need. So these nerve cells basically die off or get damaged. And this product has a very wonderful way with which it helps to, repair these damaged cells, because Forever B12 Plus contains cobalamin analog, folate analog, pyridoxine, which are essential for nerve repair and health. Now, these ingredients in Forever B12 Plus help to resolve stroke via remyelination. But let's also bear in mind that the peripheral nerves as well have Schwann cells that help to build this insulator or myelin sheet all around. Remember that the brain also controls different parts of the body through these nerves that go from the spinal cord all the way down through different parts of the body. So, more specifically, they help to counter depression, anxiety, and mood issues by improving neurotransmitter synthesis in the brain, like serotonin and dopamine. Then also improve nerve conduction and transmission. Remember that people that have stroke sometimes slow in processing information and all this. You can see this can help to resolve this kind of issue. And also help with neurotransmitter function as well. Now, it also benefits individuals with nerve-related conditions such as neuropathy. I mentioned that even different parts of the body receive messages and signals from the brain for them to function. And of course, if the nerves that go to these parts of the body, especially the ones that are on the feet or the extremities, like the hands and all that, especially when the stroke was even secondary to type 2 diabetes, where increased blood sugar has led to diabetic neuropathy, which is a very terrible thing because of the pain and tingling and other sorts of sensations, especially at the extremities, like in the legs and all that. So you can see that this will also help with that, because it benefits these individuals with nerve-related conditions such as neuropathy, or those experiencing numbness, tingling, or weakness, as aforementioned, in the extremities. That's via neuropathy, like for instance, diabetic neuropathy, and also improves neural connectivity. That is on that issue, because the part of the brain that has been damaged, or that area where the infarct is, of course, we're talking about ischemic stroke, the infarct has to be resolved, and that is the inflammation and the free radicals and all that around there have also led to damage of nerves there. So these nerves all around that area of infarct have to be repaired, and this will also help with that. So they also protect against nerve damage as well. Degeneration. Its use is so much. As the uses are so many. Let's just stop here for now. And Beautiful, exactly what we were talking about earlier. You can see Forever Royal Jelly, which contains choline, which is a precursor to the neurotransmitter acetylcholine. Yes, choline is a nootropic or smart drug. Remember that neurotropic or smart drugs are natural pharmaceuticals because that they help in human thinking, learning, focus, attention, and memory. Well, another smart drug from choline is in royal jelly is citicoline. These are all analogs of each other. And its other ingredients include amino acids, B vitamins, minerals, and antioxidants. But the ingredients in Forever Royal Jelly help resolve stroke via these specific processes. Just to mention a few, they improve cognitive function and memory, because that's one of the issues that patients have when they have stroke, because the brain is also responsible for this. Then improve mood and mental clarity. We talked about depression. They support brain health and rapid recovery from stroke. Improve nerve cell function, neurotransmitter synthesis, and brain health. Remember that in between each of these nerve cells or neurons, we have gaps called synapses, where these neurotransmitters are present and help to conduct transmission of impulses from one nerve to another at such a very fast speed that you know, even in fact, it's so fast that needs to anything that hinders or reduces the amount of neurotransmitters in those synapses or gaps can lead to a decrease in the communicative function of this nerve. Forever Royal Jelly also helps resolve stroke via damaged nerve cell regeneration, rejuvenation, and protection, and also helps to counter inflammation, oxidative stress from free radicals generated around the area affected by stroke. So let's also bear in mind that Forever Royal Jelly also helps to counter depression and anxiety. So that's what Forever Royal Jelly looks like. Yes, and so these are just a few of the things that I use for my patients, of course, and I've been having wonderful results. But you know that these things, no two patients are the same, because we can have some that have other comorbidities so the situation may have to be changed, especially if a patient is having what is called a hemorrhagic stroke, or the patient is having some other kind of issue associated with the ischemic stroke. That is why we have to kindly remember that we do not adjust medication and doses without the guidance of a trained health practitioner. It's very, very important, because what you may think may not be what it is. And on that note, I would say that you or we are what we consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So we just have to be on the list. And I'll say thank you so much for listening and being so patient, and God bless you, and good night. So, bye.